Okay, good afternoon all. Today we are seeing next bacterial infection, that is Chlamydia trachomatis. The incidence rate is most common bacterial STI. Then 38 per 100,000 females, 33,000 females, highest among adolescent girls, that is 15 to 19 years, followed women with 20 to 24 years. Then prevalence rate. Then causative organism Chlamydia trachomatis. 3 biovars of Chlamydia trachomatis, each consisting of several serovars or genotypes, cause genital infection, LGV, genital ulcer disease that affects lymphoid tissue, trachoma, eye infection. Then clinical presentation, genital infections, that is the symptoms asymptomatic, 70% of women, 50% of men. Symptoms of uncomplicated infection in women, that is abnormal vaginal discharge, dysuria, postcoital and intramenstrual bleeding. Then signs speculum examination, that is the vaginal speculum. Then cervical friability and discharge. Symptomatic men, urethral discharge, dysuria, sometimes testicular pain. Complications if left untreated, most genital infection resolve spontaneously with no sequelae, may result in several complications, mainly in young women. Then PID, ectopic pregnancy, tubal factor, infertility in women, epididymitis in men. Then the risk of complication may increase with the repeated infection. Infections of non-genital sites common. Rectal infection, rectal discharge, rectal pain, then rectal pain and blood in the stools, asymptomatic in some most cases. Then oropharyngeal infections, pharyngitis, mild sore throat, symptoms are rare. Chlamydial infection pregnancy associated with the preterm birth, low birth weight. Infants or mother with the chlamydia can be infected at delivery. Neonatal conjunctivitis and or nasopharyngeal infection. Symptoms of ophthalmia, ocular discharge, swollen eyelids, nasopharyngeal infection can lead to pneumonitis. Then LGV. How the LGV is caused? What is LGV? LGV is simple that this is a lymphogranuloma venereum. Before the slides, that is the introduction of sexually transmitted disease, that is genital infection. Everywhere we have seen this word LGV. I think I have told what the full form LGV. If not, means it is lymphogranuloma venereum. You have studied this one in your microbiology. So, and it is caused by more invasive serovar of Chlamydia trachomatis, affects the submucosal connective tissue, can spread to regional lymph nodes, commonly presents unilateral, tender, inguinal or femoral lymph node, genital ulcer or papullae, anorectal exposure, proscites, rectal discharge pain, constipation or tensomus. Left untreated, LGV can lead to rectal fistula or stricture. Then laboratory diagnosis, that is direct influenza assay, DFAS, laboratory based point of care, enzyme linked immunoassays, ELISAs. Then the NATS, nucleic acid amplification test, are strongly recommended due to their superior performance characteristics. NATS, it's a highly sensitive and specific, can be used for a wide range of samples: urine, vulvovaginal, cervical, urethral swabs. Several commercial NATs using different technologies are available, allows testing of non-invasive specimens which can be collected conveniently at the primary level of care. Commercially available NATs are not yet licensed for diagnosis of extragenital samples, reliable for detection of chlamydial infection in rectal and pharyngeal swabs. Several commercially available tests for chlamydia and combined with a test for gonorrhea. And this NATS test, that is I had told, that is a nucleic acid amplification test. It's called as to identify, what is the importance? To identify what type of organism is present, that is bacterial, either bacterial, that is viral or pathogens. What type of organisms is present, that also we can easily find out by this NATS test. Then treatment, uncomplicated genital tract chlamydia, recommended azithromycin 1 gram orally as a single dose, doxycycline 100 milligram oral twice a day for 7 days, alternate is tetracycline 500 milligram, then erythromycin, ofloxacin. Okay, then genital chlamydial infection in pregnant women, treatment methods and dosages first given. You can see, write down and you can study this one. Then for neonates, that is topical ocular prophylaxis, prevention of gonococcal and chlamydial ophthalmonium, topical application of both eyes immediately after the birth, that is tetracycline, erythromycin, then providin iodine, silvinitrate. Remarks, that is the recommendations applied to the prevention of both chlamydia and gonococcal ophthalmonium, cost and local resistance of erythromycin, tetracycline and chloramphenicol. Caution should be taken to avoid touching eye tissue when applying topical treatment. Provide water based solution, that is providin iodine. Do not use alcohol based providin iodine. Okay, thank you.